This conference is being recorded. Cette conférence est enregistrée.
Bon après-midi et bienvenue à cette conférence de presse. Good afternoon and welcome to this press conference. Je vais maintenant passer la parole au ministre Leblanc pour débuter.
I will now hand it over to Minister Leblanc
to begin.
Merci beaucoup, Jean-Sébastien. Thank you very much, Jean-Sébastien. Good afternoon, everyone. Bonjour. Today, I am joined by my colleague, Minister Anita Anand, and Doctors Tam and New. Et je voudrais commencer tout de suite en cédant la parole à ma collègue, la ministre Anand. So to you, Anita.
Thank you so much, Dom, and good afternoon, everyone. It has been incredible to see Canada's vaccination campaign racing ahead, with more and more Canadians rolling up their sleeves. To date, 3/4 of eligible Canadians have received at least one dose, putting Canada first in the G7, the G20, and the OECD. And second doses are quickly ramping up, with hundreds of thousands being administered daily. Indeed, 400,000 second doses were administered across the country yesterday, approximately. Our government has delivered more than 35 million doses to the provinces and territories, with 30 million doses administered already to Canadians. Je tiens à remercier sincèrement tous les Canadiens et toutes les Canadiennes qui se sont fait vacciner et j'encourage tous ceux et celles qui ne l'ont pas encore fait à recevoir leur première dose. Comme je l'ai déjà mentionné, mes fonctionnaires et moi-même avons travaillé fort pour que davantage de doses soient livrées au Canada plus rapidement. As a result of those efforts, as the Prime Minister has just indicated today, we are pleased to report that Canada's allocation from Moderna for the month of July is 11 million doses. What's more, these deliveries will be front-end loaded, with nearly 5 million of those doses actually arriving before the end of June, and the balance to be delivered in the first half of July. Along with the 1 million doses that we received from the United States government yesterday, Canada will receive a total of more than 18 million doses of Moderna in this quarter, well over the approximately 12 million doses originally forecasted. Comme mentionné plus tôt cette semaine également, Pfizer a modifié son calendrier de livraison pour le mois de juillet. Mais comprenons bien ceci, le Canada recevra toujours 9,1 millions de doses de Pfizer en juillet. Cela n'a pas changé. Toutefois, les livraisons des 2 premières semaines seront désormais inférieures à celles prévues initialement et les livraisons des 2 dernières semaines seront plus élevées pour compenser et combler la difference. As was also mentioned earlier in the week, Pfizer has adjusted its July delivery schedule. Let me be very clear. Canada will still receive 9.1 million doses of Pfizer in July. That has not changed. However, the deliveries in the first 2 weeks will now be lower than originally planned, and deliveries in the last 2 weeks will be higher to compensate and to make up the difference. In total, Canada is now set to receive more than 50 million doses by the end of June and more than 68 million doses by the end of July. This milestone in our vaccination campaign is the culmination of the monumental efforts of my PSPC team, who have worked around the clock since day one, continually negotiating with our suppliers in a relentless push to accelerate deliveries from later to earlier time periods this year. Our vaccine plan is paying off. We are seeing the results today, and our government will continue to bring Millions of doses here for Canadians every single week. As the vaccines continue to arrive, let us pledge to continue to work together to keep each other safe and to finish the fight against COVID-19. We have come so far. Let's keep going. Merci beaucoup, Megwech. Thank you.
Merci beaucoup, Anita. Thank you very much. So over to you, Dr. Tam, and then to Dr. New.
Thank you, Minister. Bonjour à tous. Nationally,
Hello, everyone.
the 7-day rolling averages continue to decline, and our current national average of 1,137 cases reported daily is down more than 85% from the peak of the third wave. Likewise, the average number of people with COVID-19 being treated in our hospitals each day is down more than 65% since the peak to 1,430 daily. Of these, on average, 650 people were being treated in intensive care units, and an average of 20 deaths were reported daily. Together, we've made incredible progress in lowering COVID-19 infection rates by maintaining precautions while we work to increase population immunity by expanding first dose vaccine programs and accelerating the second dose programs. The payoffs now and in the weeks and months to come will be invaluable. Just this week, healthcare workers had cause for great cheer as the Medical Surgical Intensive Care Unit at the Toronto General Hospital announced 0 COVID-19 patients for the first time since March 2020. In addition to preventing more severe illness and loss of life, our continued efforts to drive COVID-19 infection rates down everywhere is preparing us for a safer future by building a better buffer against the rise of the Delta variant. As we've seen every step of the way, the secret to all our successes has been people in Canada working together to stay informed, to help out in more ways than we could have imagined, and to step forward when it mattered most. And right now is an incredibly important moment for stepping up to get fully vaccinated. With COVID-19 disease activities waning, we have a window of opportunity to raise immunity as quickly and as high as possible to build a wall of protection through vaccination against emerging variants of concern like Delta. This week, we saw a great response to the start of the Pass the Baton COVID-19 vaccination campaign. The Canadian Olympians and Paralympians starting a relay of reasons on the importance of getting vaccinated against COVID-19. And using #MyWhy, people across Canada are joining in and sharing their own compelling stories, from protecting our health and healthcare system to getting back to the in-person connections that enrich our fitness, fun, learning, and growth. In short, Canadians are doing it for themselves, their families, their loved ones, and to be the coverage we want to see in the world. Working together, we can go for gold and get Canada back to the max. Thank you. Merci, Megwich.
Bonjour à toutes et à tous. À l'échelle nationale, les
everyone.
moyennes
On the
sur 7 jours
national
sont toujours en
level,
baisse.
the
Le nombre moyen de cas au
7-day rolling
pays
average
de
continues to decline.
1137 cas
Current
déclarés
national
par
average
jour
of
a diminué de plus de
1,137 cases has gone
85%
down by
par
more than
rapport au pic de la
85%
troisième
from the
vague.
peak of the
De
third
même, le
wave.
nombre moyen de
Likewise, the
personnes
average
atteintes de
number
la
of people with
COVID-19 traitées
COVID-19
dans nos
being treated
hôpitaux
in our
chaque
hospitals
jour
each
a
day is
diminué de
down
plus de
more than
65% depuis le
65%
pic
since the
pour atteindre
peak to
1430 cas par jour.
1,430 daily.
De ce nombre,
Of
en
these,
moyenne,
on average,
650 personnes étaient
650
traitées dans des
people were
unités de
treated
soins
in
intensifs
intensive care
et
units,
20
and an
décès
average
ont
of
été
20
déclarés
deaths
par
were
jour.
reported daily.
Ensemble, nous
Together,
avons fait
we've made
d'incroyables
incredible
progrès dans
progress
la
in
réduction des
lowering
taux d'infection par la
COVID-19 infection
COVID-19
rates
en
by
continuant
maintaining
d'observer les
precautions
précautions tandis que nous
while
nous
we work
efforçons
to
d'accroître
increase
l'immunité de la
population
population
immunity
en
by
exécutant des
expanding
programmes
first dose
d'administration élargie de
vaccine
la première dose de
programs
vaccin
and
et en
accelerating
poursuivant
second
plus
dose
rapidement les
programs.
programmes d'administration de la seconde dose. les avantages actuels et auxquels nous
now
bénéficierons
and in the
dans les
weeks
semaines et les
and
mois à
months
venir
to
seront
come will
inestimables.
be invaluable.
Cette semaine, les
Just
travailleurs
this
de la
week,
santé avaient de quoi
healthcare
se
workers had
réjouir
cause for
puisque
great cheer
l'unité de soins
as the medical,
intensifs médicaux
surgical,
chirurgicaux
intensive care
de l'hôpital
unit
général de
at the
Toronto
Toronto
a
General
annoncé
Hospital
qu'il n'y avait plus
announced
aucun patient atteint
zero
de la COVID-19
COVID-19
pour la
patients
première
for the
fois
first
depuis
time
mars
since March
2020.
2020.
En plus de
In
prévenir des maladies
addition
plus
to
graves
preventing
et
more
des pertes de
severe
vie,
illness
nos
and
efforts
loss of
continuent
life,
pour
our
abaisser les
continued
taux
efforts
d'infection
to
par la
drive
COVID-19 partout
COVID-19
dans le monde
infection rates
nous
down
préparent à
everywhere
un
is
avenir plus
preparing
sûr
us for a
en
safer
assurant une
future
meilleure
by
protection
building a better
contre
buffer
l'augmentation
against
du
the
nombre de
rise
cas du variant
of
Delta.
the number of
Comme nous
cases
l'avons
and the
constaté
Delta
à chaque
variant.
étape de
As
cette
we've
lutte,
seen
le
every
secret de
step of the
toutes
way, the
nos
secret to
réussites a
all
été
our
la
successes
collaboration
has been
de la
people in
population
Canada
canadienne
working
qui s'est
together
tenue informée
to
et a
stay
apporté son aide de
informed,
bien des façons,
to help
plus
out
que
in
nous
more ways
n'aurions
than
pu
we could have
l'imaginer,
imagined, and
et qui a agi au moment où
to
cela
step
comptait le
forward
plus.
when it mattered
Et en
most.
ce moment,
And
c'est le
right
temps
now
d'agir
is an
et de se
incredibly
faire
important
entièrement
moment
vacciner.
for stepping up to
Maintenant que
get
la
fully
propagation de la
vaccinated.
maladie de
With
COVID-19
COVID-19
est en
disease
baisse,
activity
nous avons
waning,
l'occasion
we have
d'accroître
a window
l'immunité
of
aussi
opportunity to
rapidement
raise
et
immunity
aussi
as
étendue
quickly
que
and as
possible
high as
afin
possible to
d'assurer
build a
une
wall
protection
of
efficace par la
protection
vaccination
through
contre les nouveaux
vaccination
variants
against
préoccupants
emerging
comme le Delta.
variants of concern
Cette
like
semaine,
Delta.
le lancement de
This
la
week,
campagne de
we saw
vaccination
a great
contre la
response
COVID-19
to the
passer le
start
témoin
of
a
the Pass the
suscité un vif
Baton
intérêt.
COVID-19
Des
vaccination
athlètes olympiques
campaign,
et
with
paralympiques
Canadian
canadiens
Olympians and
ont en effet
Paralympians
lancé une
starting a
relais de
relay
raison
of
sur
reasons
l'importance de se
on
faire
the
vacciner
importance of
contre la
getting
COVID-19.
vaccinated against
En utilisant
COVID-19.
mots-clics Mes
Using
raisons, les
hashtag
gens de partout au
MyWhy,
Canada
people
se
across
joignent à nous
Canada are
et
joining
racontent
in
leurs propres
and
histoires
sharing their
fascinantes.
own
Les
compelling
raisons
stories
énoncées vont de la
from protecting
protection de
our
notre
health
santé,
and
de notre
healthcare
système de soins de
system
santé, au retour
to
des
getting
rencontres en
back to
personne
the
qui contribuent à
in-person
notre forme
connections
physique,
that
notre
enrich our
divertissement,
fitness,
notre apprentissage et
fun,
notre
learning,
développement.
and growth.
Bref, les
In
Canadiens le
short,
font pour eux-mêmes,
Canadians are
leurs
doing it for
familles, leurs
themselves,
proches
their
et pour
families, their
contribuer
loved
à la
ones,
couverture
and
à
to
laquelle
be
nous
the
voulons tous
coverage
bénéficier
we
partout
want
dans
to
le monde.
see in the world.
En travaillant
Working
ensemble, nous
together,
pouvons
we can
obtenir l'or
go for
et
the gold
s'assurer que le
and
Canada
get
est
Canada
vacciné au max.
vaxxed to the max.
Merci.
Thank you.
Miigwech.
Miigwech.
Thank you very much, Dr. New. And alors, to you, Jean-Sébastien, we're obviously ready to take questions.
Merci beaucoup, Monsieur le ministre.
Thank you very much,
nous allons maintenant
Minister.
débuter la période de questions.
We'll now start the
We will now
question
take
period.
questions. As usual, it will be one question and one follow-up. Donc, comme d'habitude, ça va être une question et un suivi. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opératrice pour la première question.
Thank you. Merci. Please press *1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mike Lecouteur, Global News. Please go ahead, à vous la parole.
Thank you for taking our questions. This question is kind of split into two, one for Dr. Tam and one for Dr. Anand, Minister Anand, but both along the same subject. So with NACI's change yesterday and essentially recommending that provinces stop administering AstraZeneca, for Dr. Tam, I know you say that people should be happy that they followed the guidance and that they got their doses or first dose of AstraZeneca. There's still a number who feel like they're guinea pigs and they're not 100% sure they'll be able to travel to different places. So despite following everything, what do you say to those people? And the other one now for Minister Anand is, we have the remaining of the contract of AstraZeneca. What happens to those doses now that it seems like they won't be used in Canada?
Yes, thank you for the question. And I can certainly recognize that people may be asking questions or feel frustrated. But I think, as I said yesterday, NACI is following the science and providing up-to-date recommendations. So the most important thing is to get that second dose. And I think that people who've got 2 doses of AstraZeneca should know that they are being protected in terms of illness. And in fact, the AstraZeneca dose, even if you look at the Delta variant, if you get 2 doses, you have a very effective vaccine for preventing hospitalizations or serious outcomes. What you're weighing your choices against is, some emerging evidence showing that if you receive the first dose AstraZeneca and then you receive an mRNA vaccine, that immune response appears to be very robust and is when the studies were done to compare 2 doses of AstraZeneca with AstraZeneca mRNA, the latter appears to produce a more robust response. So, and this, as you're making that kind of decision, is weighed against where you're in the pandemic, as well as the rare side effects that we've talked about, like the thrombosis with low platelets. So there's many things that I think each individual person receiving a vaccine, of course, should be provided information on. At the height of the pandemic, the absolute imperative is to protect everyone from getting serious illness. So that's what people who've got the AstraZeneca vaccine did for themselves, as well as to protect others as well. NACI's recommendation is one of, prefer to get the mRNA vaccine because they're in plentiful supply. The studies, as I've just indicated, now you have less COVID in our country, and so the risk-benefit ratio for the even rare events start swinging in a different way. But you are, if you got your 2 doses, protected. Today, all the evidence shows it protects very well against serious illness. I do think that needs to be separated from travel requirements. For travel requirements and what might be accepted in other countries is a very topical topic for international discussion. But you got to start somewhere. And I do think most countries is going to start off with the vaccines that they know and have approved. We will also be looking at, for example, the WHO list of approved vaccines. But every country currently is trying to restart doing the best that they can. And they may start off with a smaller list. And they, like us, would be considering other vaccines as we're going along as well. So it is difficult. And for travelers, as I said yesterday, you have to check what the policy of the country that you're traveling to is requiring. The incident in the United States, I think that was reported about a concert. Now that could in fact be a state or local or, private sector policy. I don't know. I don't have enough information. So I think from our perspective, our continued engagement will be with the national level of the United States.
It's Dr. New. Maybe I can just underline a point that Dr. Tam made, and also to your question. Certainly, the NACI recommendation is not to tell provinces and territories to stop using AstraZeneca vaccine. Based on the scientific evidence about maybe a possible advantage in terms of immune response by offering an mRNA vaccine as a second dose to those who received AstraZeneca as a first dose, and also the very rare, but there is a safety signal with VIT. There is a sort of a recommendation for a preference, but it's not the same thing as saying stop using AstraZeneca totally. So certainly for those individuals who's received the AstraZeneca vaccine, the 2 doses, hey, you've made a good choice. Certainly, I can say at the time when the epidemic, the third wave was raging through the country, it offers a good level of protection against infection. Of course, very good protection, as we can see with evidence around the world in terms of serious illness and hospitalization. So certainly now with the additional information, provinces and territories will be taking that to heart. But certainly my sense is that if an individual, for whatever reason, is maybe not comfortable with receiving a sort of the mixed dose or getting a different type of vaccine, mRNA as their second dose after receiving AstraZeneca, certainly my sense is that option would be made available, obviously with full informed consent, understanding what they're doing. But it's not a hard stop to say, no, you cannot give AstraZeneca at all. So I just want to make sure that that's clear as well. Thank you.
And just to respond to the second part of your question, Mike, I will start off by saying that as a result of our diversified portfolio of vaccines, we are continuing to pull in vaccines from multiple approved suppliers. The reality is that we are working very hard with Minister Haidu's team and the Public Health Agency of Canada as their engagement continues with the provinces and territories to determine the extent of their demand for AstraZeneca. Our contractual relationships with suppliers and our contracts themselves are extremely solid, and we will be able to meet any demand that ensues from the provinces and territories. As you have seen already, we have almost 75% of eligible Canadians with at least one dose. Second doses are continuing to ramp up. And from the perspective of public services and procurement, we will continue to ensure that the supply of vaccines rolls into Canada by the millions, 50 million before the end of June, 68 million plus before the end of July, so that all Canadians who wish to have access to vaccine can indeed have that access. Thank you.
Just for my follow-up, Minister Anand, I appreciate that, but the question was, what do we do with the unused vaccines or the rest of them? But that's not my follow-up. I don't know if you want to address it afterwards. I understand that doses are coming in, but we may no longer have use for AstraZeneca, is what I'm saying, and what do we do with those doses? But I will, so you can tackle that after I ask my follow-up, but my follow-up is for Dr. Tam and possibly Dr. New. I wanted to know what the vaccine threshold should be to ease restrictions in light of the spread of the Delta variant, and whether or not there is a concern that we could be seeing a drop-off in uptake of first doses in Canada.
Okay, Teresa, I'll just start by finishing the response to the question and then hand it over to you if that's okay. In terms of the unused vaccine that is available under contract, I want to reiterate that Canada is committed to helping to meet global demand for COVID-19 vaccines. As announced by the Prime Minister, Canada has committed to donating up to 100 million doses. This continues to be a conversation across government as to further donations when that is possible. I will continue to be focused on bringing vaccines into this country and will discuss with my colleagues the resulting decisions relating to unused doses under contract. Teresa?
Thank you. And that was a very important question, and that the last part of a vaccine stretched campaign is the hardest. So far we've seen such a tremendous enthusiasm from people, but the last remaining people who haven't had their first dose yet is an important target of efforts to get more vaccines to them. So now the tactics may have to switch, for example, from mass immunization clinics, which can still occur, but to more tailored approaches to improve access to those who still haven't been vaccinated, but that they may have had difficulties accessing the vaccine. So you will see numerous different strategies to bring vaccine to the harder to reach, to people who are homebound, to other different communities. And we, the federal government, the Public Health Agency, supported a number of community-based projects in order to get those vaccine targets up. It may be language barriers. We're pulling out all stops. But that end piece of our campaign is going to be the most difficult. So in some jurisdictions, we've already seen a slowdown of that first dose while the second dose is ramping up. We need to keep going with that first dose. And as you said, it's because some of the variants who are more transmissible may need a higher vaccine coverage in the community to stop chains of transmission. We will be, doing more modeling information and studies. But all to say is that's why I've said we've got to reach for the stars. We've got to, as much as possible, even get past the 75% goal. We know it can happen because certain age groups, the seniors, for example, some groups have already gone past 90%. So if other age groups can be supported to do that, that's what we would want to see. And that sets us up for a much better fall. If the variant takes hold and we don't have high enough vaccine coverage, what you will see is probably a resurgence in the fall period, which we want to try and suppress as much as possible.
Yes, and it's Dr. New. Just to build on what Dr. Tam said, you're right. We're seeing in different parts of the country that sort of the rate of vaccination for first doses is starting to slightly plateau, and certainly not at the same sort of accelerated pace as it was earlier. And there's two components to that. One is Dr. Tam's very eloquently expresses the accessibility part. People are homebound. Maybe it's not easy for them to get an appointment or to actually go for their vaccine. And so we see that the provinces and territories are using all sorts of means to improve access to vaccine, and even language and cultural barriers. That's one thing. But the other part is the vaccine hesitancy. That's another space that we're very alive to with our innovation fund, and also the provinces and territories. You can see they're using other methods as well, as you might say, to try and appeal to maybe other motivating aspects to why people may then hopefully go forward to get the first dose, and of course then for the second dose. So those are important things that hopefully we'll get way past that first dose coverage, and then as you say, start focusing on the second doses for all Canadians. Thank you.
Thank you, Dr. New. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour à vous tous. Ma
Question.
première
Hello,
question
everyone.
était
My
pour la
first
ministre
question is
Anand.
for Minister
Je voulais
Anand.
juste plus de
I
précisions
would just like
sur les
more
vaccins.
details
Donc, il n'y a pas si
about
longtemps, on nous
the
annonçait 55
vaccines.
millions de vaccins
55
avant
million
la fin du mois de
doses is
juillet.
what
Maintenant,
was
vous parlez
announced
de
recently before the
68
end of
millions
July. Now we're
avant
talking
la
about
fin
68
du mois de
million
juillet. Donc,
before
je me
the end of
demandais comment
July. So I
expliquer
was
cette
wondering,
différence de
how can
13
you
millions.
explain this
Est-ce
13
que
million
finalement,
difference?
c'est plus de doses de
Is it
Moderna?
more
Si vous
doses
pouviez nous
from
donner des précisions
Moderna? If you
à
could
ce
give
sujet.
me
Merci.
some details on that, please.
Oui, bien sûr, et merci pour la
Answer.
question.
Yes, of course, and thank you
La
for the
situation
question.
est la suivante.
The situation is as
Le
follows.
numéro 55 doses
The
avant
55
la fin de
million
juillet était
doses before the
seulement
end of
les doses de
July was
Pfizer.
only
Mais
for
maintenant,
Pfizer
nous
doses,
avons un
but now
calendrier de livraison de
we
Moderna
have
et donc
a
nous
timeline that
allons
that
avoir
includes Moderna.
68
So we will have
millions de
68
doses
million
à peu près
doses
avant le
approximately
20 de
before
juillet.
the end of July.
Merci.
Thank you.
OK, très bien. Donc, effectivement, dans le fond, vous confirmez que la différence de 13 millions, finalement, ce
Very
sont
well. So
toutes
you're saying that the
des doses de
13
Moderna, finalement.
million doses is attributable to the
Dites-moi
Moderna
si je me trompe. Et ma
vaccine, if I'm
question
not
de suivi,
mistaken.
c'est pour le
Follow-up
ministre
question.
Leblanc. Je
For
voulais
Minister
revenir sur,
Leblanc,
en fait, les voyages et
I
cette
wanted to
preuve
come back to
vaccinale.
travel
Tout
and
à
the
l'heure, il y a le
proof of
premier ministre Justin
vaccination.
Trudeau qui a confirmé en quelque
Earlier,
sorte
Prime
qu'il y aura
Minister
une
Trudeau said
solution
that there would be a
intérimaire pour cette
solution,
preuve
an interim
vaccinale
solution
par
for
le biais
this
de
proof of
l'application
vaccination
ArriveCan.
using the ArriveCan
Et il a dit en même
application.
temps qu'il y
And
aurait
he
un
said at the
système plus
same time
permanent
that there
à
would be a more
l'automne.
permanent
Je me demandais
solution
qu'est-ce
in the
qui
fall.
bloque
I
actuellement.
was
Est-ce que
wondering, what is blocking
en
this
ce qui a trait aux négociations
process
avec les
currently?
provinces? Est-ce
That
que
is
ce
to
sont des
say, is it
questions de
negotiations
vie
with the
privée? Si vous
provinces,
pouviez
or is it
peut-être
because of
élaborer là-dessus.
privacy? Could you elaborate on that, please?
Avec plaisir.
Response. With pleasure.
Et merci encore pour la
Thank
question.
you for the question.
Je pense que le Premier ministre Trudeau l'a abordé
I think Prime Minister
plus tôt aujourd'hui.
Trudeau addressed
Et
this
vous avez
earlier
raison.
today, and you're right.
On aura une façon intérimaire
There will be
et on
an
va donner plus de
interim
détails
solution,
lundi
and we
sur
will
ces
provide
questions-là
more details
afin
Monday on this,
d'offrir probablement à travers l'application Arrive-Can, une façon pour les gens éligibles de venir au Canada d'offrir une preuve de vaccination. Et nous continuons des discussions franchement très, très constructives avec les provinces et les territoires. Ça a été abordé lors d'une rencontre, encore une fois, constructive, très productive, je dirais. Hier soir, avec tous les premiers ministres, ça a duré 2 heures. La conversation s'est portée sur des détails de comment nous pouvons collaborer ensemble afin de partager dans les mesures appropriées, tout en protégeant évidemment les questions de vie privée, mais avoir accès aux données qui sont proprement dans les mains des provinces et territoires pour avoir une solution plus à long terme, un genre de passeport vaccinal ou un certificat de preuve vaccinale. Toutes ces questions-là sont importantes aussi d'être abordées avec nos alliés, avec les États-Unis, c'est sûr, avec l'Union européenne, avec l'Angleterre. Alors, nous aurons au cours des prochains mois une façon sécuritaire, en partenariat avec les provinces, d'offrir à tous les Canadiens une preuve vaccinale pour des voyages internationaux.
Merci beaucoup, Monsieur le ministre.
Thank you very much, Minister.
Je peux vous avertir que Dr. Tam et Dr. Nu doivent maintenant nous quitter, mais les ministres demeureront disponibles pour répondre à vos questions.
Leave us now,
I must
but
now
the two
inform you
ministers
that
will
Dr. Tam
remain.
and Dr. Nu must leave, but the ministers will remain available to answer your questions. Donc, je vais passer la parole à l'opératrice pour la prochaine question.
Jean-Sébastien, c'est Dominique. Je crois que le Dr. Nu peut demeurer avec nous encore pour quelques moments. Dr. Nu is able to remain with us for a few minutes. It's Dr. Tam who has had to step out.
Ah, OK. That's right. Parfait. Ben, merci de la précision, Monsieur le ministre. Donc, parfait. Je vais passer la parole à l'opératrice.
Now I'll hand it over to the operator.
For the next question.
Thank you. Merci. The next question is from, la prochaine question est de Mia Robson, the Canadian Press. Please go ahead. À vous la parole.
Thank you. Yeah, Dr. Nu, I'm just wondering if you could talk a little bit more about this nasty decision yesterday on AstraZeneca. I've seen some family doctors and pharmacists not happy with this decision. They say that it created more confusion for patients. There was no documentation provided that was sort of patient-friendly so they could explain it, that there doesn't seem to have been that much change in the data and the studies. They're all still sort of early emerging data, and that this has just added extra confusion and concern for patients. I'm just wondering if you could address those concerns.
Okay, well, thank you very much for the question, Mia. What I would say is that with respect to the NACI guidance, as we've said on several occasions, that continues to evolve with the science. And the science is some of the studies coming out of Europe, looking at healthcare workers, looking at their immune response, are all very positive in terms of looking at a mixed dose schedule. The fact that there seems to be a better immune response for individuals who receive an mRNA vaccine after having received AstraZeneca as their first dose, but also the fact that people who receive AstraZeneca for their first 2 doses, that there's a very good level of protection. So we understand all that. So I think what's driving the NACI change in terms of sort of a stronger recommendation or preference for that mRNA vaccine as the second dose for those individuals who receive AstraZeneca as their first dose is based on the fact that, like I said, the immune response appears to be greater. And also with the fact that even though it's quite rare, the fact there is a safety signal with the AstraZeneca vaccine, which was not there, when we first started our vaccination campaign with all of the vaccines that were obviously approved by Health Canada. And that safety signal has not been shown to be the case with respect to VIT, the blood clots with the mRNA vaccine. So that I think is there. The provinces and territories were given a sort of advanced briefing of the NACI recommendations, so they're well aware. And certainly, it's within their jurisdiction to take the NACI advice and recommendations and then operationalize it according to the context, their epidemiology, and what works best in their jurisdiction. So, to your point about at the pharmacy level in terms of patient handouts and so on and so forth. Certainly that's something we would leave to the provinces and territory to know best, as they say, their residents and what might work best at a local level in terms of patient information. As I said earlier in my to previous question, is that for people who receive both doses of AstraZeneca, you've done well. You've protected yourselves, you've protected your family, you have good protection against infection. Certainly, you decreased the overall risk of onward transmission of COVID-19. Certainly at the time when there was the third wave raging through many parts of the country, and also you decreased your risk substantially in terms of severe illness and hospitalization. Now, with the fact that we have many millions of doses of mRNA coming in, the fact also that I think in many ways they're showing that there's a good immune response or better immune response with that second dose. That's why there is that option, that preference. But I think it doesn't discount the fact that for individuals who have received that first dose and still, for whatever reason, feel uncomfortable getting a dose of another sort of vaccine type and would like to complete their series, certainly my understanding at the provinces and territories, they will take that into account, and certainly as they roll out the vaccines, that would be part of the I would say the logistical aspect in terms of taking the orders from obviously the federal government in terms of the number of vaccines they anticipate being able to use in that respect. So I think at the end of the day, the fact is we have a suite of vaccines in Canada. We're doing very well, as Minister Anand has said, with respect to first dose vaccination. Hey, 75% of Canadians have now received one dose, I would say eligible Canadians. And now we're moving in very well with the second dose coverage. My understanding is that we're closing in on that 20%. And as you can see, provinces and territories are taking that to heart, and they're moving ahead with their reopening plans, I think, hopefully in a cautious way, looking obviously to make sure that they're not having an adverse impact on community transmission, and more importantly, straining the healthcare system in terms of hospitalizations. But all things are trending in the right direction. And so I think we just need to keep pushing in terms of vaccination for Canadians.
Thank you. And I'd also like to ask you about the Delta variant and what we know about it in terms of tracking it. It seems the Health Canada website that tracks variants still does not have a Delta or any of the B1617 lineages on there. It seems difficult to get that data at a provincial level. Is it actually harder to figure out whether this variant is in place? Does it take longer? And what does that mean for our ability to actually control any outbreaks?
Well, you've raised a very good issues in terms of data gathering. Certainly at the federal level, we work closely with our provincial territorial counterparts to get data. But you're right, there is a bit of a lag, and we do rely on the provinces and territories in terms of when you do get obviously a laboratory confirmation of cases of COVID-19, to the extent that they can, as you say, sequence the variants to determine if it is a variant of concern, and then transmit that data to us. That there is obviously some issues that we need to obviously work on at the present time, and it keeps changing. Is that I'm aware of in terms of the Delta variant. As of today, I was looking at the latest data. There's about 2,000, a bit over 2,000 cases that have been reported to us, but we always appreciate the fact that it's probably an underestimation. There's probably more cases there. The other aspect that we're also learning from our provincial and territorial colleagues is that, and I think it underlines an important point, is that the Delta variant, certainly some of the outbreaks that have been reported are among unvaccinated individuals, and certainly because the variant has been shown to be more transmissible and obviously also maybe lead to more serious illness. It just underscores the point that people need to get not just that first dose, but that second dose as well. Studies and the experience in countries in Europe have shown that there is a good level of protection against a Delta variant with one dose, but it's much better with two doses. So the quicker we can get everyone to receiving their two doses, the better we'll all be in terms of, how you say, being protected against COVID-19 in general, but more specifically the Delta variant. So it's something where we're tracking with our PT colleagues, as we say, and it's something that we're very alive to in terms of tracking the outbreaks and looking at what we can do. And I would say, especially what we might call pockets of unvaccinated individuals throughout the country.
Thank you, Dr. New. Merci, Dr. New. Donc, opératrice, pour la dernière question et dernier suivi. So, operator, over to you for the last question and follow-up.
Thank you. Merci. The last question is from La dernière question est de Brian Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, I'm wondering with the shipments that you announced today, it would seem that we should be able to vaccinate all the currently eligible Canadians in July or at the latest in early August. I'm wondering what you think the likelihood of that is, and whether or not there are any roadblocks that have you concerned when it comes to being able to vaccinate Canadians that quickly.
Should I start, or Minister Anand? I think there's two parts to your question. Maybe it's Dr. New. I'll start in terms of the actual administration of the vaccine. Certainly, as we work with our provincial territorial colleagues, the public health capacity, the actual capacity to administer the vaccines is there, and they're ramping up, and you can see that the doses are being administered at a very good rate. But in several provinces, the rate is starting to slow down in terms of first vaccines administered. And so, as we've mentioned earlier, the issue of, I guess you might call it either accessibility or vaccine hesitancy is now coming to the forefront. So with respect to accessibility, certainly the provinces and territories are very live to that.
Maybe I'll take over until Howard gets back. Ryan, is that all right? Listen, in terms of the supply, you're exactly right. We do have a steady stream of vaccines coming into the country, and the announcement today is very good news. 50 million plus before the end of June, 68 million plus before the end of July. But the reality is that there are a number of factors that need to be taken into account, and it is for that reason that we are sticking with the time frame that we've previously discussed, being the end of September. What are those factors, you ask? First of all, supply chains are still volatile. There is still a global competition for vaccine. We are watching our supply chains extremely carefully, watching every plane land and every shipment get out to Canadians. So I'm not taking my eye off this ball until we have enough vaccine in the country for all Canadians, and that means continuing to operate in this globally competitive environment. The second factor that we should be aware of is that while we have supply in the country, we are still making sure that that supply gets out to the provinces and territories as soon as possible, and then the shots have to go into arms. And so making sure that those factors are taking account of in the process of the timeline and the estimations is extremely important. As you know, we are being extremely careful with our procurements and with our distribution of vaccine to make sure that things stay on the right track. But this is a process, and we will continue to draw down on our very strong contracts to ensure that all Canadians have access to two doses of vaccine as soon as possible. Thank you.
Yeah, I guess just as a follow-up, Mr. I know you said before that Canada paid a premium to be able to pull doses from later in the year into earlier in the year. Are we still doing that? And can you provide us an estimate of what that has cost to move up all of these doses?
Well, to be clear, Ryan, the payment to each supplier depends on the terms of the contracts. And it is not true across the board that we pay a premium for doses that we accelerate. In fact, we have accelerated 34 million doses to date, and the contracts do differ on the extent to which we pay a premium for accelerated doses. So the conversations and the negotiations with the suppliers continue, but our goal, in light of the fact that we are in the middle of the pandemic and we are still requiring supply to get out to Canadians, is to bring in as many vaccines as soon as possible. I will reiterate that Canada has paid fair value for the vaccines that it has received. That is, we are continuing to negotiate with our suppliers for the most expeditious deliveries to Canada at the fairest price. Thank you.
Thank you,
Just,
Minister
Dr. New, just checking
Anand.
to see if you can at least hear me. Oh.
Yes, we can, Dr.
Oh, that's fine. For Minister Anand, well, I guess my internet's still quite spotty, so I'm just here if there's any additional questions. Otherwise, I'll just stay off camera. Thank you.
Thank you, Dr. New. Donc, voilà qui met fin à cette conférence de presse. That marks the end of the press conference. Thank you for being with us. Merci d'avoir été parmi nous. Bonne journée.
Merci. Bon après-midi tout le monde. Have a great afternoon.
Au revoir.
Have a great weekend, everyone. Thank you.